So let's begin with the NSAIDs. So NSAIDs is basically these drugs are the non-steroidal anti-inflammatory drugs which have antipyretic and analgesic effect. Okay, so also known as the antipyretic analgesic drugs. Okay, so basically these NSAIDs, they are first generation NSAIDs and they can be second generation NSAIDs. The first generation NSAIDs are like non-selective, and the second generation, they are selective COX-2 inhibitor. Okay, so the non-selective, why the first generation non-selective, we can say because the first generation non-selective, they doesn't select between the COX-1 and COX-2. Okay, yeah, so they doesn't select, they inhibit both, either it is COX-1 COX-2, they will inhibit both. Okay, so hence they can lead to an ulcer also as a side effect. Okay, while the while the second generation NSAIDs, they are selective COX-2 inhibitor. Okay, so there will be like, it will inhibit only COX-2, so there will be no ulcer. Okay, as a side effect. Okay, and the selective COX-2 inhibitor, in their name can be like Coxib. Okay, in their drug name. Okay, now the like this one, non-selective COX inhibitor. Okay, so the non-selective COX inhibitor, like for example acetaminophen, which we all know by the name of paracetamol. Okay, so this paracetamol, what it will do, it will also inhibit the COX-3. Okay, and its use are basically, we can use as an antipyretic. Okay, as well as as well as analgesic also. Okay, so but one problem is there, that it is like it has no anti-inflammatory 1 minute, I'm sorry. Yeah, now it's visible. Okay, so basically see, so we can use this acetaminophen, that means paracetamol, for fever and all. Okay, because it has antipyretic effect, it has analgesic effect also, so we can use in case of pain also, but we can't use in case or situation of anti-inflammatory, because it doesn't have that property, it does not have this property anti-inflammatory, that's why. Okay, and also one thing, that it can cause the hepatotoxicity, which one, it can cause the zonal hepatic necrosis. Okay, which is also seen with this like carbon tetrachloride. Okay, why, so why it is causing hepatotoxicity? Because of a toxic substance, toxic metabolite, that is known as the NAPQI. Okay, so what is happening, it will increase, so when these and when this metabolite increase. Okay, so what's happened, because of this because this metabolite is increased, it will lead to decrease in the glutathione depletion, and glutathione is an antioxidant, so if if it's decreasing its activity, then what will happen, there will be more injury. Okay, and so basically that's how it is leading to hepatotoxicity. Okay, so that means if we inhibit this NAPQI, okay, we can we can use it in another drug, for example this one, N-acetylcysteine. N-acetylcysteine inhibit the NAPQI. Okay, and replenish the glutathione, that means glutathione will again increase, and its antioxidant property will again increase. So it means that we can use in case of acetaminophen or paracetamol, it is the same drug, means same name. Okay, either we can say paracetamol, either acetaminophen, so its toxicity, in that we can use the N-acetylcysteine. Okay, so that simply means that. Okay, then comes the aspirin. So aspirin has some special points, that aspirin has, okay, aspirin has like antipyretic and antipyretic effect and analgesic effect. Okay, but the aspirin also has one special point, that is it has anti-aggregant activity. Okay, so means antiplatelet activity, so it's used in case of prophylaxis of the MI and strokes. Okay, now the aspirin also have another properties like anti-inflammatory effect. So basically the anti-inflammatory effect of aspirin seen in case of high doses. Okay, high doses 325 to 625 mg, and it shows anti-aggregant effect with the lower dose, for example 40 to 325 mg. So this lower dose is known as the baby aspirin. See, aspirin is not used in baby, never, it should never be used in baby, because it's lead to Ray's syndrome. Okay, so that's why it should never, it is contraindicated in the children. Okay, so this low dose, why we call this a baby aspirin, because of its low dose only. Okay, 40 to 325, and in low dose it shows anti-aggregate property. Okay, now basically see, I have told you that it should never be used in the babies. Okay, so another one is endomethacin. Endomethacin is used for closure of patent ductus arteriosus. Okay, it is used in case of patent ductus arteriosus, but the drug of choice for patent ductus arteriosus is ibuprofen. Okay, another one is this one, that is the ketorolac. Okay, ketorolac. Okay, this ketorolac is basically used in post-operative operation, means after operation when the patient is having pain, then we can use this ketorolac. Okay, because its effect, even though it is NSAIDs, but its effect is equal to opioids. Opioids are also used in pain, right? So for that, another one is mefenamic acid. So mefenamic acid is used in case of dysmenorrhea. Okay, then another one, now we will talk about the preferential COX-2 inhibitors and selective COX-2 inhibitors. So in case of preferential COX-2 inhibitor, there can be like, for example, diclofenac and nimesulides. Okay, but nimesulides can also lead to hepatotoxicity. Okay, now the selective COX-2 inhibitor, it can be like celecoxib. See, coxib is coming in their name. I have told you previously also that COX-2 inhibitor, in their name coxib is coming. See, I will show you. So here it is, I have told in COX-2 inhibitor coxib will come. Okay, so I have told this. Okay, then but it is least selective. Okay, yeah, then and the side effect of the NSAIDs, it can lead to nausea, vomiting, it can lead to peptic ulcer disease. And on chronic therapy, if we are giving NSAID for long of period, okay, for like so many days or so many, how to say, like months, okay, then it can lead to not days, months we can say. Okay, so it lead to increased risk of MI. Okay, so that's why it's better to avoid all the like NSAIDs in MI except the aspirin. Which one? Low dose aspirin. Okay, low dose aspirin. Another thing is that aspirin should be avoided in children, otherwise it lead to Ray's syndrome. I have told this already. Okay, and in Ray's syndrome there will be like in the children there will be liver dysfunction and there will be like encephalopathy, brain means problem. So it is contraindicated in the children. Okay, then one thing is that this aspirin is basically, it can also increase the uric acid, so hence it should never be given in case of gout also. And one more thing of the drugs is that, for example, if there is a drug, so if the drug is acidic, for example like barbiturate or like aspirin, so these are the drug, okay, acidic drug. Then alkaline drugs, like for example amphetamines, these are alkaline drugs. Okay, now let's say if the drug is acidic, okay, so what will happen, it will get absorbed in our body by in the acidic environment only. Okay, and suppose the drug is of alkaline nature, so it will get absorbed in our body in alkaline medium only. Okay, now basically how we will remove it, so acidic drugs are basically removed by forced alkaline dihydroases. Okay, that means biocarbonate and all. Okay, now associated with alkaline. Okay, now the alkaline, if the, like we have to remove alkaline from the body, we can use the forced acidic dihydroases. Okay, so that's all.